Today's revision, we are focusing on looking at the Medsurge paper, and this is for June 2025. So we'll go straight, we start looking at the multiple choice questions. So the first section, we are focusing on the multiple choice questions, and the first question says, which diagnostic test is most commonly used to assess lung function in asthma? The correct answer is C, which is spirometry. Question 2 says, which of the following is a common cause of pulmonary embolism? The answer is D, which is DVT, which is deep vein thrombosis. Question 3 says, which of the following is a typical finding in a patient with emphysema? The correct answer here is B, which is a barrel chest. Question 4, which of the following is the most common cause of coronary artery disease? And the answer is D, which is atherosclerosis. Question 5, which of the following is a classic symptom of myocardial infarction? And the answer here is C, which is chest pain radiating to the arm. Question 6, the primary goal of dialysis in kidney failure is to. The correct answer is B, which is remove waste products and excess fluids. Question 7. Okay, so this paper skips 7 and we go all the way to 14. So 14 says, what is a hallmark symptom of laryngeal cancer? The correct answer is B, which is persistent hoarseness. Question 15, what is the primary treatment for severe epiglottitis? And here the correct answer is D, which is emergency airway management. Question 16, what is the most common cause of pharyngitis? And the correct answer here is D, which is viral infection. Question 17, which condition involves abnormal bone growth in the middle ear causing hearing loss? And here the correct answer is B, which is otosclerosis. Question 18, which of the following antiretroviral drugs belong to the non-nucleoside reverse transcriptase inhibitors? And the correct answer is A, which is efavirenz. Question 19, renal toxicity is associated with. The correct answer is C, which is tenofovir. Question 20, which of the following HIV tests can confirm the HIV in newborn? And the correct answer, of course, is D, which is the NAT test, which is the nucleic acid test. This is the one that can confirm HIV in a newborn. 21, a discordant couple who wishes to have baby may decide to. So the correct answer is D, which is use pre-exposure prophylaxis. Question 22. A patient with a history of excessive bleeding and joint pain is likely to have which type of hemorrhagic disorder? And here the correct answer is B, which is hemophilia. Question 23. Which of the following condition is caused by an infection of the inner lining of the heart, often involving heart valves? The correct answer here is, of course, C, which is infective endocarditis. The next question, 24, says Toxoplasma gondii can be described as, and the correct answer is D, which is an intracellular obligate. 25. In the physiology of pain, the first stage is known as, and the correct answer is C, of course, which is transduction. Question 26. Damping syndrome is a complication of, and here the correct answer is, of course, D, which is subtotal gastrectomy. 27. Shock which occurs during spinal cord injury is referred to as. The correct answer is A, which is neurogenic shock. 28. Which fracture is most commonly associated with fat embolism syndrome? The correct answer here is, of course, A, which is, of course, the correct answer here is for 28 is B, which is femur fracture. When we go to 29, so 29 says, a patient with blunt abdominal trauma presents with guarding and rebound tenderness. What is the most likely diagnosis? The correct answer, of course, is C, which is gastric ulcer. Question 30. Okay, rather 29, the answer is A and not C, which is gastric ulcer. Based on this scenario, the correct answer is A, which is peritonitis. Question 30, which compensatory mechanism occurs first in hypovolemic shock? The correct answer, of course, is C, which is tachycardia. Question 31. Which fluid is most appropriate for initial resuscitation in major burnt patients? The correct answer is B, which is Ringer's lactate. 32. Which oral disorder is a precancerous white patch that cannot be scraped off? The correct answer is, of course, A, which is leukoplakia. 33. Which of the following is the most common cause of an acute abdomen? And the correct answer, of course, is A, which is acute appendicitis. 34. A patient presents with sudden onset severe epigastric pain radiating to the back. What is the most likely diagnosis? The correct answer here is B, which is perforated peptic ulcers. 35. A patient presents with severe throbbing tooth pain, fever, and facial swelling. What is the most likely diagnosis? The correct answer is D, which is dental abscess. 36. Which clinical sign is a common characteristic for peritonitis? And the correct answer here is C, which is rebound tenderness. 37. Which symptom is most characteristic of gastric outlet obstruction? So the correct answer on this one is A, which is projectile vomiting of undigested food. 38. What is the most common cause of chronic gastritis? The correct answer here is D, which is Helicobacter pylori infection. 39. During the removal of the chest tubes, the patient is asked to. The correct answer here is, of course, D, which is hold a breath as the tube is being removed. Okay, so we go to the next question, which is 40. What is the diagnostic test or choice for pyloric stenosis? The correct answer is D, which is ultrasound. 41. The classic migratory pain of appendicitis begins in the correct answer, of course, is C, which is periumbilical region. 42. Which type of gangrene is caused by Clostridium perfringens infection? The correct answer, of course, is B, which is gas gangrene. 43. Flail chest is diagnosed by. The correct answer is C, which is paradoxical chest wall movement. 44. The artery that supplies blood to the diaphragm is called. The answer is D, which is, of course, inferior phrenic arteries. 45. Which medication is commonly administered to prevent blood clot formation in post-operative patients? The correct answer, of course, is C, which is warfarin. 46. Which of the following is the most common cause of ischemic stroke? The correct answer, of course, is A, which is thrombosis. 47. Which condition is characterized by demyelination of neurons? The correct answer is D, which is multiple sclerosis. 48. A positive Babinski's reflex in an adult indicates. The correct answer is C, which is upper motor neuron lesion. 49. Which medication is commonly used for acute management of status epilepticus? The correct answer is B, which is diazepam. 50. Which part of the brain is responsible for coordination and balance? The correct answer, of course, is C, which is cerebellum. So that is all about the multiple choice question. We move on to the matching questions, and we go straight to 51 on the matching questions. The matching says match the anti-TB drugs in column 1 with their common side effects in column 2. And 51 says streptomycin. So streptomycin, the correct answer is E, which is of course tremors. 52, ethambutol, and the correct answer is D, and this is optic neuritis or blindness. 53, pyrazinamide, the correct answer is A, which is arthralgia or joint pain. 54, isoniazid, the correct answer of course is C, which is peripheral neuritis. 55, rifampicin, the correct answer is B, which is orange or red urine. So that is about the first set of matching. The next set of matching says match the following investigations in column 1 with their conditions in column 2. 56 says blood culture, and this is G, which is typhoid. 57, gas analysis, the correct answer is C, which is asthma, where we do arterial blood gas analysis. 58, colonoscopy, the correct answer of course is F, which is Crohn's disease. And 59, which is electrocardiography, the correct answer is A, which is hypertension. And here we just try to assess the cardiac complication in the hearts, of course. 60, occult blood test, the correct answer is of course E, which is hemorrhagic anemia. The third set of matching says match the terms in column 1 with their explanations in column 2. 61 says flame burn. The correct answer is B, and this is a burn caused by direct exposure to open flames. 62 says papule. The correct answer is C, which is elevated, palpable, circumscribed solid lesion. 63, skin graft. The correct answer is G, which is surgical transplantation of the skin to replace burn damaged tissue. 64 says pustule, and the correct answer is E, which is elevation of the skin containing pus. 65, crust. The correct answer is F, because this is a dried residue of serum, pus, or blood on the skin surface. That is about the third set of matching. The last set of matching says match the refractive errors in column 1 with their corresponding descriptions in column 2. And 66 says myopia. The correct answer is B. Myopia means nearsightedness, which is difficult seeing distant objects. Question 67, hyperopia. The correct answer, of course, is A, which is farsightedness, which is difficult seeing near objects. Question 68, astigmatism. The correct answer is E, which is irregular corneal curvature causing blurred vision. 69, presbyopia. The correct answer is C, which is age-related loss of near vision. Question 70, anisometropia. The correct answer, of course, is D, which is an equal refractive power between eyes. So that is about the matching questions. We move on to the completion questions. And 71 says, a neurological disorder that may occur in individuals with advanced HIV or AIDS causing cognitive and motor deficit is called, the correct answer here maybe is psychosis, of course. 72. The antiretroviral medication commonly used in HIV and AIDS treatment to inhibit viral replication is called, the answer is tenofovir. 73. The medical term for the passage of black tarry stool often indicates of gastrointestinal bleeding is called, the answer is malena. 74. The primary site of tuberculosis infection in the lungs is known as the answer is gone focus. 75. During percussion, the sound felt on hollow organs like lungs is called, the answer is resonance. 76. The hormone that regulates the production of red blood cells is called, the answer is erythropoietin. 77. The form of malaria parasites that are taken up by mosquitoes during a blood meal are called, the answer is gametocytes. 78. A progressive neurodegenerative disease that affects motor function and is associated with loss of dopamine producing neuron in the brain is called, the answer is Parkinson's disease. 79. The recommended drug for treatment of gonorrhea when using syndromic management is, the answer is cefotriaxone. Of course, it should often be combined with azithromycin when using it like this, and that is the best combination when using syndromic management. 80. The causative organism for chancroid is called, the answer is, of course, Haemophilus ducreyi. That is the answer. 81. A valve disorder in which the mitral valve fails to close properly, allowing backward flow of the blood into the left atrium is known as, the answer is, of course, mitral valve regurgitation. 82. The branch of medicine that deals with the study of skin diseases is called, the answer is dermatology. 83. Cheilitis is the inflammation of the answer is lips. 84. Diabetes caused by lack of antidiuretic hormone is called, the answer is diabetes insipidus. 85. The irreversible widening of the portion of the bronchi resulting from damage to the bronchial wall is called, the answer is bronchoectasis. 86. Inflammation of the eyelid margin is called, the answer is blepharitis. 87. A sight-threatening complication of uveitis characterized by inflammatory cells in the anterior chamber is called, the answer, of course, is hypopyon. 88. Photophobia and ciliary flash are hallmark signs of, the answer is acute iritis, also known as anterior uveitis. Question 89. Regarding drug administration, eye drops should be instilled in the answer is, of course, lower conjunctival sac. 90. An eye condition characterized by a misalignment of the eyes leading to double vision is called, the answer is strabismus. 91. The fracture which occurs at the distal radius with dorsal displacement is called, the answer is Colles fracture. 92. The surgical fixation of a joint is called, The answer is, of course, arthrodesis. 93. The medical term for club foot is called, and the answer is Talipes equinovarus, or Talipes equinovarus. 96. A type of surgery that uses effect of freezing to treat tissue disease is called. The answer is, of course, okay, we'll skip number 94. 94 says, a condition characterized by abnormal softening of bone is called. The answer is osteomalacia, which we see in adults, and in children called rickets. So it's either osteomalacia or rickets. 96. A type of surgery that uses effects of freezing to treat tissue disease is called. And the answer, of course, is cryosurgery. 95. The inflammation of the tonsils is known as tonsillitis. 97. An incision made into the urinary bladder with a drainage tube left in situ through the abdominal surface is called. The answer is suprapubic cystostomy. 98. The term for painful swallowing is called. The answer is odinophagia. 99. The diagnostic gold standard for esophageal disorder is called. The answer is upper endoscopy, also known as esophageal-gastrododenooscopy, which is esophageal-gastrododenooscopy, or simply known as upper endoscopy. So either of the two words is acceptable. 100. The term for delayed gastric emptying is called gastroparesis. So that is how we can answer the multiple choice, the one-word answer, multiple choice, and the cross-match. So this particular paper had questions for Medsurge, which is acute abdomen with the specific cause of ascariasis. The other question is for, of course, HIV. The other question is, of course, for asthma. So these are the three essays that are in this paper, and we are going to look at all these three essays on how we can attempt them fully. Till next time, goodbye.